Thank you, Brandy, for such an informative presentation. I would like to introduce psychodermatology, which is a fairly new branch in science under the umbrella of PNI. Psychodermatology examines the interaction between the mind and the skin. It also shows how much the skin gets impacted when the immunity system is disrupted. We all have some level of stress in our lives, whether it's related to professional, emotional, or social situations. This stress affects our brain, specifically our immune and endocrine systems. The body then starts to react and tries to cope by producing hormones and chemical factors to counteract these sudden changes. A high level of stress on our body can lead to a variety of problems. And believe it or not, skin problems are common in people who are under chronic stress. Now, to understand the role of PNI in this situation is to understand the role of neuropeptides, hormones, and neurotransmitters and their interplay during stress stimuli. Stress could be internal or external. Now, because stress disrupts the homeostatic balance of the organism, the body then tries to adapt to the stress situation. The reaction is translated by an increase of communication between the skin, the endocrine system, and then the central nervous system. This reaction happens mainly between the hypothalamic pituitary adrenal axis and the sympathetic adrenal medullary axis. The anterior pituitary gland secretes an adrenocorticotropic hormone into the bloodstream, which stimulates the release of glucocorticoids and catecholamines from the adrenal glands. Then comes which acts as a modulator on the hypothalamus and inhibits the further release of corticotropin factor. The sympathetic system is stimulated and produces epinephrine and norepinephrine. With all of this happening, neuropeptides are then released at the cutaneous sensory nerve that is translated into a local inflammatory response and psychocutaneous disorders such as eczema, atopic dermatitis, or psoriasis. It is important to mention that cytokines are the main immunotransmitter and coordinator between the immune and neurotransmitter systems. And when the stress is high, the secretion of this neurotransmitter is also high. Various clinical observations have pointed to the close relation between the brain system and how they affect each other. It also shows how our body works in symbiosis. Studies on mice showed that blocking glucocorticoid in mice under stress yielded a better skin condition. However, it is still not clear how to obtain the same positive results on humans by manipulating the glucocorticoid hormone, but research is still ongoing. Now, the question here is, how can aromatherapy help the body resolve over the stress situation and subsequently heal from the stress-triggered skin disorder? Meditation and relaxation are recommended to calm the mind so the treatment of the external symptoms is effective and conclusive. And as Brandy mentioned earlier, it is essentially important to adopt positive thinking and positive attitudes because negative feelings and thoughts can have serious implications on the body, but the good news is that it is treatable. Aromatherapy can bring a solution at two levels. It can alleviate the stress, and it can also help treat the skin condition caused by the stress. Stress management and relaxation techniques have been found to be quite useful when treating these skin conditions. So, by using essential oils, we can reduce the effect of stress on the skin through massage and this is beneficial, of course, to the limbic emotional region of the brain through inhalation or through warm baths and massage sessions. Research has found that aroma compounds have a positive effect on stress-triggered skin conditions, and that inhaled aromas have been found to positively affect the adrenal system through the sympathetic nervous system. The essential oils that would help in this case would be the essential oils with sedative, anti-inflammatory, and antibacterial effects properties. The best ones that are easy to use are the citrus oils, because they have a cheerful reaction. They have a mood lifting property in case of stress and depression. They're best used in steam inhalation or in foot massage. Lavender has a healing property, and we all remember how René Godefroy healed his burns, with lavender oils. Ylang ylang also has healing properties for the skin. Lavender and eucalyptus can be used to reinforce the immune system. Ylang ylang, orange, and lavender can alleviate depression. I have a few recipes here to relieve stress and also to treat skin conditions. The first one is for stress. 4 drops of bergamot essential oil, 4 drops of geranium essential oil, and 2 drops of vetiver essential oil can be added to a warm bath and or blended with 1 tablespoon of grapeseed oil. And soak in the bath for 15 to 20 minutes. Inhale the vapors, but remember not to get the bath water in your eyes, and it will sting. The second recipe is uplifting, and it's a recipe for to use it with a vaporizer. 3 drops of sweet fennel, 4 drops of lemon, and 3 drops of sweet marjoram. These oils can be added to a tablespoon of water and put in a vaporizer. The third recipe is for eczema. 4 drops of Roman chamomile, 4 drops of petit grain bigarade, and 2 drops of ylang ylang, 2 drops of lemon verbena, 6 drops of peppermint, and 20 milliliters of calendula. They can be used as a massage, as an application for the eczema. Now, for atopic dermatitis, we can use 4 drops of palmarosa, 2 drops of Roman chamomile, 2 drops of true lavender, 1 gram of tarragon essential oil, 1 gram of blue tansy, and all of this mixed in 50 milliliters of wheat germ-based oil. Again, this can be applied to the dermatitis. This presentation was for the American College of Healthcare Sciences, Aromatherapy 501. Thank you for listening.